I am going to talk about TOMI Specular Microscope EM4000. First of all, I would like to tell for what we use specular microscope. Specular microscope is to observe endothelium, which is single-layer cells on the back surface of the cornea, and its role is to maintain the function of the cornea. Main tasks of the endothelium is sustenance of the cornea through components of the aqueous humor, and to pump water by means of a sodium-potassium hydrogen carbonate pump out of the stroma into the anterior chamber, the same time forming a passive barrier against fluid going the opposite way, thus keeping the cornea clear. In case of any disturbance of this pump or barrier function, there would be more influx of aqueous humor into the stroma, thus development of cornea edema and cornea opacification. The problem here is that the cell density or number decrease by aging or external factors such as surgery, and once the endothelium cell decrease, it cannot be recovered again. Any lesions due to disease or physical forces will lead to cell migration and increase in size of neighboring cells, which again could have negative effects for the cornea opacity. Due to this reason, the analyzing the density, size, and shape of endothelium cells by specular microscope is essential before all eye surgery. Not only for IOL, but also for standard cataract treatment, it becomes more important to know the starting condition before surgery. Clinical information of cell density becomes very hot in the moment, particularly for femtolaser in cataract surgeries. Even for the contact lens fitting, there are strong recommendations to check the endothelium condition in advance. When it comes to the patient after surgery, we use specular microscope as the postoperative monitoring. So, there is a lot of cases that we should check the endothelium condition. As there are a lot of demand for specular microscope, several of manufacturer offering this kind of device. So, I would like to explain feature of TOMI Specular Microscope EM4000, like easy operation, fast analysis, various analysis method, wider capturing, easiness to use, data print and export. I would like to start from the top, easy operation with automatic measurement. TOMI Corporation is good at auto alignment and measurement technology, and this feature is of course implemented into the EM4000. What we need to do for measurement is just instruct the center of the cornea by touching the screen. Then the auto alignment starts, and the measurement starts automatically once the alignment has completed. Second feature is fast analysis. EM4000 can finish measurement in 1 to 2 seconds per eye, and that data is analyzed in background during the measurement of the other eye. Thus, the analysis for both eyes will be finished in 2.5 seconds. When it comes to the analysis methods, there are 3 options: automatic analysis, core method, and L-count method. With automatic analysis, we can just select the captured image and analyzed result appears. The data displayed on the screen is number of cells, cell density, average cell size and so on, including appearance of hexagonal cell percentage. This is automatic analysis on EM4000. The data displayed on the screen is number of cells, cell density, average cell size and so on, including appearance of hexagonal cell percentage. Regarding the endothelium cell image displayed on the screen, we can select from original image, with trace line, color-coded by size or color-coded by shape. The core method is to count cells by pointing a center of the cells manually. This analysis method is useful for the patient that is difficult to take wide and clear image. It is recommended to mark more than 50 cells at least to have more accurate and reliable value. By manually specifying cells, it is possible to prevent errors in cell counting. Third method is L-count, that we can only analyze cells in the specified area. This method is good for the patient whom cell images cannot obtained in some area and want to perform analyzation avoiding such area. With L-count method of analysis, some cell size and shape related information will be blank. EM4000 also have function to analyze dark area, where the cell image drops out from the picture. We can see the size, number, and some other information of dark area by using this mode, and which is valuable for the patient of Fuchs endothelial corneal dystrophy. When it comes to the analysis screen, there is two options, both eye mode and single eye mode. Both eye mode is to compare the both eyes information in one screen, and single eye mode it to see more detailed information of the eye, like with a graph of classified shape or size. Talking about the measurement position, it is important to examine not only the center of the cornea but peripheral cells conditions. EM4000 has 13 points of fixation light position, 1 in central, 6 in near central, 6 in pericentral. Not only the case of central position cannot be captured well due to corneal disease, but also patient got surgery, peripheral points of examination is recommended. For example, post-surgery effect to endothelium cells is said to be appeared from peripheral after ICL surgery because the ICL sometimes pushing up the iris and it contact to the peripheral cornea. Here is the data management option. EM4000 has built-in printer so the measured data can be printed easily and soon after the measurement. Two buttons on the measurement screen can be assigned from various functions, including export, save, and print, or those combination. Also, internal database can store the examination data of about 16,000 patients. As for more about export and printing, EM4000 can not only export data to PC through data transfer but also can print out with external printer without any additional operation. Last feature that we would like to tell is TOMI Standard GUI, Graphic User Interface. This interface is the same as other TOMI devices like OA2000, MAR 6000, and so on. Thus, it is familiar field to users of other TOMI devices. But even if not, EM4000 operation screen, buttons, icon, etc. are made to be easy to operate intuitively. Here is the summarization. Specular microscope is necessary instrument for many of ophthalmic facilities. EM4000 supports effective clinical operation with its fast and automatic measurement and analysis. A variety of analysis methods allow suitable analyses to be performed for many patients. Peripheral fixation lights, intuitive operation, and data management options fit into any facility's workflow. Thank you very much.